and offer transportation to shelters for those who are infected. Meanwhile, here at home, thousands of unhoused people are living in encampments throughout the Sacramento area. And today, a team of medical students went into one of those encampments to help educate and screen for COVID-19 symptoms and also to provide care. The group is called Encampment Med Team. They were recently sworn in as disaster relief workers by Sacramento County. Today, dozens of those medical workers went to a camp along Roseville Road. And joining us live right now is Jericho Halari. He's with the Encampment Med Team. Jericho, thanks for being here with us this evening. Tell us a little bit, first of all, about your team and also what you do.
Yeah, so we are Encampment Med Team, and we're a group of 23 medical students from California North State University and UC Davis. We provide medical outreach to Sacramento's unhoused population, and currently, we're trying to get a better understanding of how coronavirus is affecting them. We provide them with updated information about coronavirus, low acuity medical care like wound care, basic hygiene supplies. And then, if they do end up having coronavirus or have symptoms of coronavirus, we connect them with the licensed providers so they can get tested and into isolation housing.
Great job. Well, we know that you've seen a few people out there and have sent them to the hospital, these people having COVID-19 symptoms. Explain, if you will, how that process works, and also what have you been seeing out at these encampments?
Yeah, so the process begins with us doing a preliminary screening. We collect their medical history, we take their temperature and oxygen saturation levels, and based on that information and their clinical presentation, we determine if they are at high risk for having the virus. And we're now partnering with Metro Fire, and we have contact with their captain, who can get his mobile integrated health unit over to us and perform further evaluation. And if he needs to, then we can do a nasopharyngeal swab and get transported to the hospital. In terms of what we're seeing, that's an interesting question. The good news is so far we've encountered a largely asymptomatic population. But just this last week, we were informed that 2 unhoused individuals tested positive, and so that certainly raises some concern that we haven't quite hit the hot spots yet. But the lower testing rates in the unhoused population, we think there might be an underestimate of how frequent coronavirus is spreading in their communities.
Now, are you seeing that people out there at these encampments are getting the help they need?
To an extent, yes. So there are extra hand washing stations being put out there. There's soap and water so that they can wash their hands. In terms of their knowledge, though, of the virus and how it's spread, we're having to do a lot of correction for that information because they don't have access to the media outlets like we do.
Well, Jericho, we appreciate all of the work you're doing out there. Thank you for taking time out of your busy schedule to join us and to share your experiences with us. So we appreciate it.
Thank you, Walter.
All right, here is a look at the very latest numbers in California right now. More than 1,100 people in the state have died of the virus, and there are now more than 30,000 confirmed cases. Meanwhile, across the country, the U.S. has more than